Dr. Rachel Rubin, urologist with fellowship training in sexual medicine. And today I'm going to talk to you why your doctor might recommend a shot to your penis to help with erectile function. I know that sounds crazy, but we talked in our last video about how to talk to our patients about erectile dysfunction. It's not so easy to talk to our patients about this issue, but it is important. Erectile dysfunction can be a marker for cardiovascular disease, and 50% of our 50-year-old patients suffer from erectile dysfunction. So as doctors, we must do a better job of talking to our patients about erectile dysfunction and letting them know that it's a marker for overall health. So how do we treat erectile dysfunction? There are many things you as a primary care doctor can do to help your patients with treatment for erectile dysfunction. And I'll talk about some of the things that we as urologists do to help our patients when you run out of options in your own toolbox. So let's get started. What's important to have a healthy erection? Well, you really need three things. You need healthy muscle, healthy nerves, and healthy arteries. If anything goes wrong with your muscles, nerves, or your arteries, this is what leads to erectile dysfunction. So as primary care doctors, you can think through the algorithm of your patient's medical history. Do they have diabetes, which can affect their nerves? Do they have high blood pressure, which can affect their arteries? Do they have problems with testosterone, which can affect the smooth muscles of the penis? And so understanding your patient's history can be really helpful when you figure out what is the best treatment strategy for your patient. Now, in order for the penis to work, those smooth muscles have to relax. So your brain has to be relaxed. Your pelvic floor muscles have to be relaxed. And the smooth muscle of the penis has to be relaxed so it can fill with blood, increase in girth and size, and hold that erection in place. And so what are the treatments that we have? Well, we have a toolbox, and that toolbox is very biopsychosocial. Bio, meaning there's a lot of biology involved. Remember, muscles, arteries, and nerves. And then, of course, there's a lot of psychosocial things involved, because if your brain is stressed and you have a lot of adrenaline around, that can tighten those smooth muscles and cause you to lose the erection. So what are the treatments that we have? Well, let's start with lifestyle treatments. A healthy heart is a healthy penis. So all the things you already recommend for lifestyle changes can really help with erection problems. Sleep is so important. Does your patient need a sleep study? Do they have sleep apnea? Are they exercising? There's recent data to show that exercise may be just as effective, if not more effective, than Viagra. How about a good diet? There's a bunch of studies out there. Mediterranean diet seems to be the most helpful. And so really encouraging your patients on diet, exercise, sleep, and lifestyle changes. What about sex education? Well, that's really important too. Our patients don't always we didn't get great sex education in medical school, so our patients probably didn't get great sex education in middle school. So asking the questions, talking to them, explaining what is normal, really getting to the details, offering book suggestions and things like that. Mental health. I can't stress enough how important mental health is to a great sex life. And so everyone would benefit from sex therapy. Literally, everyone can get better at sex. They just have to get better at communication, education, and really working with their partners to maximize their quality of life. So we recommend going to psychologytoday.com or going to ASECT, which is a great way to find sex therapists in your area. Call them up, talk to them, and use them as common referral networks. Now, in the biopsychosocial approach, there's a lot of biology that we can play with. So medications and hormones. Well, testosterone has been shown to help low libido and maybe a little bit with erectile function. So checking testosterone levels can be very helpful. Pills. We know Viagra, Cialis, Levitra, and Stendra, the PDE5 inhibitors, have been around since the late 90s and work quite well for many people for erectile dysfunction. Viagra and Cialis are generic now, and you can get them really inexpensive using a GoodRx coupon or cost plus drugs. You don't even have to worry about insurance coverage there. And so pills work by relaxing the smooth muscle of the penis so that it fills with blood and then gets erect. Now, they don't work for everybody. So if pills stop working, we often talk about synergistic treatments. Sometimes you need pills and devices. So devices need to be discussed more regularly in the doctor's office. You as a doctor should be prescribing devices for all your patients. We talk about eyeglasses and wheelchairs. Why don't we talk about sexual health devices to help people have more fun and more success in the bedroom? So what are different kind of devices that your patients can use? Well, a common one can be a vacuum pump. Vacuum pumps can be very helpful for erectile function. You lubricate the penis, it goes inside, you can press a button which causes a suction to bring blood into the penis, and then the patient would use a constriction band on the base of the penis to hold that erection in place. Vacuum pumps can be very effective. We also sometimes recommend devices that vibrate, or devices that the patients can wear that can both hold the erection in place as well as vibrate the perineum to allow for a better orgasm. So there are many devices out there. Sex tech has really expanded to help our patients. There are devices looking at erectile fitness. It's like a Fitbit for the penis that can help both with holding onto the erection and even gathering some data, which may help in patients understanding the firmness of their erections. So not only can devices be helpful, but sometimes it's not enough to allow for an erect penis hard enough for penetration. And so sometimes we really have to increase that muscle relaxation to the penis. And that is where we often recommend a shot to the penis. I know it sounds crazy. If your muscles, arteries, and nerves are not working, then we sometimes have to maximize that smooth muscle relaxation by using medicines directly into the penis itself. It's a tiny needle. It doesn't hurt, but as doctors, we recommend these injections that can be quite helpful for our patients. Now, what happens when your patients don't even respond to injections or any of these synergistic treatments? Well, as urologists, we often discuss a surgical option for our patients, which is called a penile implant. Now, these penile implants are surgically placed in our patients, and there is a pump inside the scrotum that fills with fluid and then allows for a rigid erection. Now, these can be wonderful tools for our patients who can no longer get erections. They've tried everything, or they just don't want to finagle with this toolbox. And so talking to a urologist about the pros and the cons and the risks and the benefits to these surgeries is really, really important and quite helpful. Now, remember, erectile dysfunction is a marker for cardiovascular disease. So your patients may need a workup by their cardiologist. They may need to make sure that you're optimizing their general health, but don't forget the fact that we have to ask our patients their goals, what they care about, and figure out a way to find a toolbox that makes sense for the patient and potentially the couple to maximize their quality of life and sexual health. Don't give up. If you have questions, let us know.